This is about a program that may stop some people from receiving their next paycheck. The question is whether or not it's fair.
Is a new program aiming to give a hand up to those in need, infringing on their constitutional rights. People on welfare will now have to be drug tested before receiving their government money. $500,000 has been set aside for the pilot program in Michigan, aiming to prevent welfare money funding drug use. Welfare recipients who refuse to take a drug test will lose cash assistance for a year.
So obviously there are a lot of people for a pilot program like this, which it is right now, who would say, okay, well, here's the pros. Maybe it ensures tax dollars go to people who really, really need it for the right things.
But I have to say that people who really, really need it, if somebody has a drug or alcohol dependency problem, they need it just as much as the one that doesn't. But the good needs help and assistance.
No, but when you talk about money, the point of the program would be, okay, maybe identifying...
Well, you're trying to control where the money goes, but those people, everyone needs help.
Well, they identify somebody's using drugs, but then do they try to help them?
They do.
To beat the problem?
Yes,
they do?
They submit them to drug and alcohol counseling for a year.
They actually, yeah, so my question for you is, there is a positive side of this, as I read more about it, is that the people would then, if they are drug addicts, they can still receive their payment, but they're also given resources for substance abuse programs at the same time. So there's not, but you can't just, I mean, where I would disagree with you is this concept that, like, you know, if you're, people would say if you're aiding and abetting people's drug habits and not offering any support beyond just, hey, here's money to go use on illicit drugs, there's people, a lot of people would say they have a problem with that.
Well, what I have a problem with is the chance of a false positive result, because we've discussed here on this show before, there are a lot of non-illegal, non-abusive drugs that can cause a urine toxicity.
And just doing the tests is very expensive.
Right, it is. They are going to set aside $500,000. I guess conceptually, I am challenged by the notion that we're advancing the idea that anybody who's receiving government assistance is either shiftless or drug addicted, and we know that even in that the study in Florida, the amount of people who were on government assistance and who were drug tested was actually 2%. The national average is 8.7% of people.
So the point is...
that they are using drugs at a lower rate than the national average. So the idea of testing people makes no sense.
Would you believe in a program where, because my biggest issue with this is this whole idea of discrimination and who you pick and who you're going to drug test. A lot of professions, a lot of jobs, before you can get your first paycheck, you undergo drug testing.
Pilots are drug tested. I mean,
so drug testing is more and more.
Well, drug testing for doctors was on the ballot this year in California.
So that positive concern of yours is across pretty much all professions. Really, I think the hot button issue here is
who gets tested, and do you test everyone or do you test some?
And again, in medicine, we say it all the time, before you do a test, you should know what you're going to do with those results. Exactly. And right now, we're not sure if that's...
Well, and the good thing, whether you're for or against this, at least they're starting it as a pilot program as opposed to making
it permanent law,
because this could be abused, misused. There's a lot of things that could go wrong with this.
Absolutely.
So time will tell how this plays out.